just to be clear, the FDA, when they announced the full approval, their press release read, "Today, the U.S. Food and Drug Administration approved the first COVID-19 vaccine. The vaccine has been known as the Pfizer-BioNTech COVID-19 vaccine and will now be marketed as Comirnaty for the prevention of COVID-19 disease in individuals 16 years age and older. The vaccine also continues to be available under emergency use authorization, including for individuals 12 through 15 years of age, and for the administration of a third dose in certain immunocompromised individuals. There are no soldiers currently serving in that population, except for individuals who just go to basic training at 17. Is that correct?
Yes, sir. 17 is the minimum.
And so there are no soldiers serving on AGR of the age of 17. Is that correct?
No, sir.
Okay. So everyone who would be asked, there is an FDA-approved vaccine that is currently serving on AGR or would be 18 prior to or on June 20th, 22. Is that correct?
Yes, sir. That's my impression.
As we talked a little bit about this, there are almost a dozen vaccines that you are required to take upon initial entry to the military. Is that correct?
Yes, I did a deployment to Liberia, and I had to get anthrax, salmonella. I mean, there are quite a few that I had to receive. Yes, sir.
And those are given to you as a lawful order. You will get these vaccines. Is that correct?
Yes, you have to take the vaccines or you cannot go in the country.
Right. But at basic training, you are given a lawful order. You will receive these vaccines, or you will be.
You get discharged.
And they will. That is the same process that we were talking about for anyone who refuses. Should we get to a deadline? We are not talking. You as the JAG are not saying we're going to invent a new process to provide UCMJ. You are saying there's an established process, and as the JAG, you routinely advise people about, from your experience, how this process works. Is that correct?
Yes, sir. There's a standard process in place.
And as the JAG, when people ask you, hey, sir, what would happen if I don't, you provide them with advice and counsel.
I do.
Colonel Bennett, when your leaders and soldiers ask you, they're asking you from your experience how these things happen. Is that correct?
Yes. Yes, sir.
And so the piece that you are, that as commanders, as leaders, you are opining on providing command leaders with advice so that they can give good advice to their soldiers about what is likely to happen, and you and none of the soldiers under your chain of command have been applying any level of coercive action aside from do what you're supposed to do. Is that correct?
Yes, sir. That's the hallmark of how General Rogers wants us to run our shop. Now, one thing I want to say is that we can do better, and we're gonna do some strategic communications when we get back to make sure commanders are reminded, right, that when somebody applies for an exemption, they're allowed to apply for the exemption. We're going to go through the process, and we're going to make sure that people are reminded about commanders' open door policies. If they don't like if they don't like something that somebody said, they can go to the next higher up in the chain of command and get it fixed. We work really well with the chain of command. It's an operational factor for us that is a force multiplier, and unless or until we're notified of these problems, we can't fix them. So we regularly urge service members to come up to us, use the open door policy, and ask for help. That's what we're here for.
Colonel Wojciak, you said you received the anthrax vaccine. Is that correct?
I have.
And when that came up, there was some degree of controversy about that. Do you recall, or have you processed any religious exemptions that were successful in your almost 20-year career?
So I've been on active duty for 20 years. I've been in for 32. And I do recall when the anthrax vaccine first came out, we did have incidents with some of our A-10 pilots at Battle Creek that elected not to take the vaccine and leave service. But none of them were discharged.
And none of them received a religious exemption?
I don't know if they requested one, sir.
Okay. But in your career, you've never been a part of anyone successfully receiving a religious exemption?
I have not seen one.
And so when your soldiers ask you about it, the advice that you are giving is not, you cannot get one. It is, in my career, I have not received one or I have not seen one. That is what people are hearing, is that soldiers are saying, hey, we have not seen one. It is not you saying it is impossible.
We do a bi-monthly National Guard JAG all-call with all 54 states and territories, and the phrase that is used during those calls, sir, is that the Secretary of Defense has not approved one yet.
Okay. And so,
That doesn't mean that doesn't mean they're not going to be approved. It just means that none have been approved yet.
but I just want to make it clear that the guidance has been not yet, not in my experience. It has not been. You will not receive one. You cannot get one. Do not apply.
That's correct, sir.
Okay. And so, as we've talked about this, there has been no one at the National Guard Bureau in Michigan or at any level that has said you cannot receive a waiver.
No, sir. I've not been made aware of that.
And if it were to happen, you would seek to remedy that. Is that correct?
Well, I would talk to the commander and ask the commander to remedy it, sir. Yes.
Okay. And just one last thing. I know there was a comment about soldiers dying from COVID. We have had soldiers in the Michigan National Guard who have died from COVID. Is that correct?
Yes, sir. We have.
Were they? Was that vaccinated or unvaccinated? Are we keeping track of that number?
I don't know if we're keeping those numbers. Levita, do you know?
Sir, we did have 2 of our technicians who died, and neither were vaccinated.
Just for the record, the Vice Admiral John Noel, the Chief of Naval Personnel, recently discussed that of the 164 deaths in the Navy family due to COVID-19, 144 of them were not immunized. So as we talk about this, there's a clear distinction between those who are immunized versus those who are not, as it relates to mortality and our ability to fight and successfully deploy. But as you talk about these kind of things, the goal here is medical readiness, and that is the way it has always been described on the Michigan National Guard's ability to deploy, to complete missions, and to gain more missions from the space, which is always our goal. Is that correct?
Yes, sir. Unless we maintain a ready and deployable force, we're not going to be able to maintain the force structure or the funding that we're receiving from the federal government. If we can't deploy people, they're not going to need us.
And Fred, just to be clear, the Michigan National Guard is actively trying to get more missions, actively trying to get more personnel, actively trying to get more investment in the state. And Secretary Austin has made it abundantly clear that to be mission ready and to get those missions, which we all want, we need to be medically ready. And that includes receiving the COVID-19 vaccine.
Yeah, absolutely, Senator. I think to just drive that home, in my 14 years being on legislative staff and now with the department for almost going on 3 years, I've not seen the level of focus and attention of us trying to attract these new missions and these new investments like we have been doing over the past several years, working with both the state legislature as well as our federal CODEL, and then General Rogers and his advocacy and knowledge of how the Pentagon works. So we are well positioned to win some major investments in the state of Michigan going forward into the future. And yes, that would all be put at jeopardy if we don't have compliance with a lawful order as it's issued by the DOD.
Thank you. Thank you, Mr. Chair.